Hello, my name is Jara, and today I'll be performing a preoperative skin preparation. So usually we do this procedure prior to surgery. So I will be doing my assessment first. So for my assessment, I will just make sure that my patient have completed all the necessary doctor's order, and also if there's anything that needs to be done prior to inducing of the anesthesia for the patient. So just check on that, because usually we do this a day prior to the surgery. And then I would also do my skin preparation after the induction of the anesthesia is done, and also if the patient is already in the operating table. So you do that just prior to the surgery. And then for my nursing diagnosis, it would be risk for infection related to improper aseptic technique. And my outcome, I would like to make sure that my patient maintains, will be free of infection post-operatively. Usually that's 2 to 3 days after the surgery. And for my intervention, first I would like to do my surgical scrubbing technique. So I would be outside the operating room. Usually there's a sink there. You would do your surgical scrubbing technique, do your 30 strokes, 20 strokes, and also just make sure that you cover until the elbow of your hands when you're doing this procedure. Then after that, you would like to also supply with your alcohol-based rub after doing that. And then just make sure that you do this before the draping. And then usually skin preparation is done because you would like to mechanically cleanse the operating site and the extensive parts of the body prior to draping this patient. So you would like to do you would like to make sure that your disposable skin prep is here. Usually it's in a pack like this. Let's just pretend this is my disposable skin prep. And then I will open it in a sterile table. So usually there's a sterile table ready already, and then just put everything there. Make sure that you don't put your hands below your waist, because you don't want to cross-contaminate anything. Then after that, just make sure that the proper antiseptic solution that you're going to be using is here. Otherwise, you have to get the circulating nurse to get that proper antiseptic solution for you. So just follow the manufacturer's instruction when you're applying the solution for this patient. And then just make sure that you would like to expose the skin when you're prior to even putting the solution on the patient. So when you're exposing the skin, you would like to put on a sterile towel on top of it, and also underneath the patient. That way we could we could protect the patient from anything that's the burn or any solution that's going to be flowing out. So you would like to protect this patient just by putting some sterile towels underneath and above the site. And then just make sure that you remove the towels after the surgery. And then once you place that towel there, you would like to observe the skin area of this patient and see if there's any abnormalities that you could find. Just document all your findings later. So just assess this area first, and then just make sure that all the proper equipments are ready when you're doing this procedure. And then just take your surgical gloves, put your surgical gloves, put it in a sterile field, and then just open the sterile packet, and then do the open method. So I would just pick up the cuff. Just make sure that you don't contaminate it with your skin. And then just make sure that the surgical gloves that you're using is also appropriate on the size of your hand. And then after putting on your gloves, you would like to pour your solution onto the sterile basin. So I pretend that I poured that already. And then get your gauzes or whatever you need. Usually some gauzes like 4x4s. And then just soak it with the antiseptic solution. And then just make sure that you observe the important skin prep procedures or the principles that you always start inside to the outside of the field. That way you don't cross-contaminate from the cleanest to, you want to do the cleanest to the dirty part, okay? So this one have the antiseptic solution already. So I would start in the middle, that's my inside, in a circular motion. And then I would discard this one and then get a new one and soak it there. And then do the outside area. And then I would discard this one as well. And then if you need to do more, just get a new one. And then just, you know, cover the area that needs to be sterile. And then after this, you would like to, you know, usually the contaminated area is generally prepped the last, so that's also the principle that you would like to follow. Then for your evaluation, so after doing the surgery with the surgeon, you assist the surgeon doing this. Right after the surgery, would doff all your dirty PPE, so take off your gloves, and then all your necessary PPE, just make sure you take it out. And then when you're documenting all your findings, just make sure that you, you know, like write the pre-op instructions that you already mentioned this to the patient, and then you also like just check that everything is cleared prior to the surgery, and then the removal and handling of the jewelries for the patient, and also if there's any denture that was removed, just document all of that. If you need to, you know, shave the hair, or if there's any hair removal, you have to document that, and also who did that shave removal or the hair removal, or who shaved that area. Just document all of that. The preparation parameters, just document all of that. The time of the prep, and also if there's any methods or antiseptic use per manufacturer's recommendations, so just document all of that. If there's any other, you know, antiseptic solution that you used, and then you know, you would like to also document the assessment that you did the skin before and after the surgery. So just document all your findings, and then do your evaluation, check the patient 2 to 3 days post-operatively if there's any infection that had developed to that patient. So that will end my nursing skills for the pre-operative skin preparation. Thank you and have a good day.